Once again, it's Dr. Tom from addictionbuster.org and the roughly 2-minute blog review. Today's topic is going to be prescription drug addictions, and in particular, prescription drugs and teenage drug addictions and drug abuse. There's a huge problem with prescription drugs today, and we know that there's a tremendous amount of abuse and addiction to prescription drugs. There's roughly 200,000 visits to emergency rooms every year in this country due to prescription drugs. And prescription drug overdose is responsible for more drug deaths than all of the illegal drugs thrown together. Of course, nicotine and alcohol kill more people on a yearly basis. But just looking at prescription drugs and the difficulties that arises, one has to entertain the big three. And the big three, I would say, from prescription drugs that cause problems are pain meds. You know, we all know about them. Vicodin, Oxycontin, Percodans, Percocets, hydrocodone, hydromorphone, oxycodone, Talin, Ultram, Buprenex. There's a lot of these things that cause difficulties. Of course, the other sedative hypnotics such as Xanax, Valium, Klonopin, Ativan. And one that causes a tremendous amount of difficulty are the drugs written for attention deficit syndrome. Adderall is a big deal now, and a lot of kids are on Adderall. So current estimates are about 10% of high school kids, high school seniors, have taken some type of prescription drug that they shouldn't have gotten their hands on. Naturally, they're going to get these drugs from their parents. Keep in mind that children are very curious. They watch you, they imitate you, and they're going to see what's going on in your life. If you're taking one of these types of medications, they're going to know about it, and they might experiment as well. It's also well known that kids that start eating prescription drugs like this, pain meds, sedative hypnotics, uppers, things like Adderall, amphetamine derivatives, they have a much greater incidence of becoming drug addicts and or alcoholics. So, you know, these things are apparent. Everybody knows about it. And the problem is that prescription drug use, abuse, and addiction is going crazy in this country. I teach college part-time now, and I hear from so many students the use of Adderall is off the hook. It's very easy for a kid to go to some doctor and fill out some form. Perhaps they even know how to answer the questions right, and end up with a prescription of Adderall or some of these amphetamine derivatives. And they're using them for, to study, to focus perhaps. But drugs like Adderall, amphetamines, these meds that get you wired for 440 can be very dangerous. You can drink like a scalded dog on these drugs, and also you can engage in some weird behavior that can be problematic as well. So as a parent, if you're on these types of prescription meds and they're way overprescribed, I mean, when I was in practice, about 40% of my patient load came from doctors who were giving patients these addicting medications. They ended up getting strung out on the meds and had to be detoxed off of them. And people who take Xanax, drugs like Xanax or drugs like Oxycontin, things of this nature, Adderall, if you take these meds on a regular basis for 30 days, you're going to have a hard time getting off of them. Some people have big time problems getting off of these drugs. So just to kind of synopsize this whole topic, prescription drug abuse and addiction is really bad, and it's getting worse. So be on your toes, and your kids will know. And with that, this is Dr. Tom from addictionbuster.org wishing you a pleasant day, and I hope this information has been helpful to you. Bye.